allergic reaction and anaphylaxis. An allergy is an adverse reaction that the body has to a particular food or substance in the environment. Most substances that cause allergies are not harmful and have no effect on people who are not allergic to them. Any substance that triggers an allergic reaction is called an allergen. Common allergens include pollen, house dust mites, mold and pets. Less common allergens include nuts, fruit or latex. An allergy develops when the body's immune system reacts to an allergen as though it was like a threat, like an infection, and it produces antibodies to fight off the allergen in a reaction called immune response. Next time the person comes into contact with that allergen, the body remembers the previous attack or previous exposure and produces more antibodies. This causes a release of chemicals in the body that leads to an allergic reaction. Common allergic disorders include asthma, eczema, hay fever. Symptoms of an allergy can include sneezing, wheezing, coughing and skin rashes. The nature of the symptom depends on how you come into contact with the allergen. For example, you may experience problems with your airways if you breathe in pollen. Anaphylactic reactions are those that cause a serious reaction that affects the respiratory system, and this can be life-threatening. The allergen could be ingested, it could be inhaled or absorbed through the skin or even injected like a bee sting. Allergic reactions are not just anaphylactic types of reactions. They can be different levels of reactions, which includes allergies, sensitivity, and intolerance. An allergy is a reaction produced by the body's immune system when it encounters a normally harmless substance. Sensitivity is an exaggeration of a normal side effect produced by contact with a substance. For example, the caffeine in a cup of coffee may cause extreme symptoms such as palpitations and trembling, when it would normally only have that effect if taken in very large quantities. Intolerance is where a substance such as lactose or gluten causes unpleasant symptoms such as diarrhea for a variety of reasons, but does not involve the immune system. People with intolerance to certain foods can typically eat a small amount without having any problems. In contrast, people with a food allergy will have a very bad reaction even if they come into contact with a very small amount. Where someone has an intolerance or sensitivity, treatment is often to remove the source and let nature take its course. But where there's an anaphylactic reaction to an allergen, Auto Injector Pens are often used to inject a preset dose of adrenaline into the muscle of the body, which reduces the effects until emergency help can be obtained. Anaphylactic reaction include itchy skin or a raised red rash, swollen eyes, lips, hands and feet, feeling lightheaded or faint, narrowing of the airways which can cause wheezy and breathing difficulties, abdominal pain, nausea and vomiting, and also collapse and unconsciousness. Anaphylaxis should always be treated as a medical emergency. If you suspect that you or someone else is experiencing symptoms of anaphylaxis, you should always call 999 immediately. Now, there are different types of auto-injector pens a person might have. A person might have an EpiPen, a jext, or an emerade. These are prescribed from a doctor to that person, and they should always carry 2 with them at all times, because if the first auto-injector pen hasn't worked, after 5 minutes, it may be that the person needs a second one. Another reason you might need 2 is in case the first one has been misused, misfired. How to help someone that's having a severe allergic reaction or anaphylaxis. Now, if you notice someone is struggling to breathe, go over to them, identify yourself to them, say you're here to help, see if there's anything you can do for them. They might indicate that they want their medication by pointing to their bag or their jacket. Go and get their medication for them and give it to them. Now they should be able to use it themselves, but of course, if they can't, then you can administer it for them. Please always make sure you call the ambulance before you do this as well. Now, how to use an Auto Injector Pen. As I mentioned before, there's 3 types of Auto Injector Pens on the market. There's a EpiPen, and a jext, and an emerade. Now, the EpiPen and the jext work in a very similar way. You must always hold them across the way. Never put your thumb over the top of an Auto Injector Pen. You remove the top lid. The needle comes out of the reverse. You must make sure that you've called the ambulance first. You reassure the patient. You sit them down. You hold their knee and you distract them by getting them to look at something else on the wall. You aim halfway between the knee and the hip, along the seam line of the trousers and slightly up, and you hold the Auto Injector Pen into that thigh muscle for 10 seconds. Now that was the EpiPen we just showed you, and the exact same thing is true for the jext. So you remove the cap from the top, you hold it securely around, making sure you don't put a thumb over an end, just in case there's a wrong end you put your thumb over. You hold the casualty's knee, or they will be holding their own knee. They will swing, they will jab it in on the outer of the thigh, and they will hold for 10 seconds. After they've held for 10 seconds, they can massage the area if needed. Now, as I mentioned, there's 3 different types of Auto Injector Pens, and each of these types have a different time limit you should hold them for. The new EpiPens, it says to hold them for 3 seconds. The new jext, 10 seconds. And the new emerade pen, only 5 seconds. I suggest this is all very confusing, and you just hold them all for 10 seconds because you want to make sure that person gets that adrenaline into their muscle as quick as possible, and you don't want to delay that treatment, and you don't want to risk only holding a pen that's supposed to be meant for 10 seconds for 3 seconds and wasting that time. These pens are one use and one use only. If you mess up, then they might not have a second pen, even though they should always carry 2 around, they might not. Now with this new emerade one, then the way to use that is quite easy because it's actually only one end. So you remove the lid, the cap if you like, the needle comes out of that end. It's less confusing than the other 2 pens. Make sure after you've injected the person with adrenaline, you reassure them and you get them to massage the area. And it should have an immediate effect on that person. You can administer the second one after 5 minutes if needed. But hopefully the emergency medical service will be on the way and they'll be with you very soon. If the person stops breathing, then you need to perform CPR.